All right, let's put on our detective hats and dive into the pretty wild, hidden world of medical parasitology. We're basically going on a mission to track down some of the planet's most slippery and microscopic culprits. So, let's get this investigation started. So here's the big question, right? It's a classic detective's dilemma. When your suspect is literally invisible to the naked eye, well, the investigation turns into a real medical mystery. These tiny organisms, they operate in total stealth, leaving behind just this trail of symptoms and biological clues for us to follow. So who are these invisible intruders? We're talking about parasites, of course. These are incredibly specialized organisms that have absolutely mastered the art of survival by living on or, inside other living things. And they're not just simple germs. Oh no. They have these complex life cycles and really intricate strategies for staying completely hidden from view. So our mission today is to follow the evidence. We're going to examine the crime scene, which in this case is the human body, and piece together all the clues, from the very first signs of trouble all the way to a definitive diagnosis. It's going to be a journey into a totally fascinating field of medical forensics. Okay, so where does any good investigation start? At the scene of the crime, of course. In the world of parasitology, that means we're looking at the host, the victim, if you will, and identifying the evidence they present. These are the telltale signs that an intruder is at work. And the very first clues we have to work with? The symptoms. See, a parasite can't stay hidden forever. Its presence causes a reaction in the body, a distinct pattern of illness that gives us our first real lead on its identity. And get this, the clues can be completely different depending on the culprit. On one hand, you've got this internal attack. A parasite like Cryptosporidium wages this war inside the body, causing this awful, chronic diarrhea, especially in patients with weakened immune systems. But then on the flip side, some culprits leave their evidence right there on the surface for everyone to see. The hookworm, Ancylostoma, literally leaves a winding, super itchy trail on the skin as it moves around. Two totally different crime scenes pointing to two very different culprits. So, once we have a lead, the next big question is, how did the culprit even get there, and how does it spread? See, every parasite has an escape and transmission strategy, what we're going to call its getaway plan. Understanding this is the next crucial step in our investigation. This method of operation, its MO, if you will, is its life cycle. And this isn't some random process. It's an incredibly elaborate and often super complex scheme that makes sure the parasite can survive, reproduce, and move on to its next unsuspecting host. Just take a look at the schistosoma yeast. This thing is brilliant, and it pulls it all off using an unwitting accomplice. As you can see, it starts with eggs in fresh water. Those eggs hatch and infect a very specific go-between, a freshwater snail. That snail then becomes this living factory, releasing swarms of infectious larvae back into the water, all ready to penetrate the skin of some unsuspecting person. Without that snail, the whole plan just completely falls apart. Now, other parasites, they don't need an accomplice in the water. No, they have their own personal getaway drivers. In science, we call these vectors. They're usually insects that physically carry the parasite from one host to the next. And just like identifying a getaway car in a heist, identifying the right vector is absolutely crucial. As this table shows, for Lyme disease, the vector is the Ixodes tick. For the plague, it's fleas. For African sleeping sickness, it's the tsetse fly. And these aren't random pairings at all. The parasite has often co-evolved with its vector, perfectly adapting to make sure it can get from point A to point B. In every case, if you can stop the vector, you can often break that chain of transmission and stop the disease in its tracks. Okay, so we've examined the crime scene and we've figured out the method of operation. Now it's time for the final phase of our investigation. It's time to bring in the forensic team to definitively ID our suspect. It is time to crack this case. In medicine, forensics means diagnostics. And just like a real detective wouldn't use a fingerprint kit to analyze a bloodstain, a medical detective has to choose the right tool for the job. You've got to match the test to the specific parasite you suspect. So for a parasite like Toxoplasma, the key forensic tool is something called serology. Now, think of it this way. When an intruder breaks in, your body's immune system creates these specific antibodies that act like a record of the invasion, kind of like fingerprints left at the scene. Serology is the technique we use to find these antibody fingerprints. By analyzing them, we can tell not only if you've been exposed, but even if the infection is recent or happened a long time ago. And choosing the right tool also means knowing which ones are the wrong ones. Trying to find toxoplasma with a stool sample? That's a total dead end. It's not an intestinal parasite. Using a blood smear? Nope, that's for blood-borne agents like malaria. Acid-fast staining? That's the right tool, but for the wrong culprit, like cryptosporidium. Each test is incredibly specific, and using the wrong one is just like chasing a false lead. So, after following the clues, understanding the methods, and applying the right forensic science, we can finally reach our verdict. Let's do a quick recap of what our investigation has actually revealed. Well, we've learned that the clues these parasites leave behind are incredibly diverse. We've seen that their transmission methods are seriously complex and pretty ingenious, often relying on other organisms to complete their life cycle. And maybe most importantly, we've learned that cracking the case requires precision. You have to choose the exact right diagnostic tool to confirm the identity of our microscopic suspect. All of this reminds me of a quote from the master detective himself, Sherlock Holmes. The world is full of obvious things which nobody by any chance ever observes. It feels so fitting, right? The world of parasites is all around us, this constant invisible drama playing out in water, in soil, and inside other living things. It's a whole world of clues just waiting for an observant investigator to come along and piece them all together. And that really leads us to our final thought. We've solved a few cases today, but we have barely scratched the surface. With countless microscopic species still out there, yet to be discovered, you just have to wonder, what other culprits are out there? And what fascinating medical mysteries are they causing, just waiting for the right detective to come along and solve them?